Listening Test, Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31-42, choose the answer, A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a presentation on treating scoliosis by a physiotherapist called John Booker. You now have 90 seconds to read questions 31-36.
As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis. Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief. Although not all scoliosis sufferers will experience pain or even discomfort, many do, and for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of tight muscles through gentle massage, acupuncture, the use of supportive postural taping, and various electrotherapy modalities such as ultrasound. Phase 2 is a particularly important step for several reasons. It's for rectifying any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility have increased. Physiotherapy here focuses on both sides of the spine as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, muscle length and strength, as well as endurance and core stability. This stage is paramount for allowing ongoing treatment in Phase 3 to occur. This is because it's there that the patient requires the strength and flexibility gained in Phase 2 in order to resume normal activities. These include sport and recreation, which is the objective most patients have in mind during the treatment process. It's where we aim to restore full function. This is where we, as physiotherapists, need to tailor rehabilitation to the specific patient so they can safely achieve their functional goals. This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilised. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies greatly. However, those with mild to moderate scoliosis who have a commitment to maintaining their newfound strength and flexibility can expect a full recovery, especially if diagnosed and treated early. Physiotherapy is a vital part of this recovery and prevention and should never be underestimated. So, the next time you're asked, "Can physiotherapy help my condition?" I'd be inclined to give a firm nod and respond by saying, with your commitment, physiotherapy is invaluable.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Christian Thomas, who is talking about the diagnosis of cancer and a new tool called CancerSEEK. You now have 90 seconds to read questions 37 to 42.
My guest today is Dr. Christian Thomas, co-author of a study into a new blood test known as CancerSEEK. Dr. Thomas, can you tell us what led to the study?
Diagnosis for many cancers is a long and challenging process. Cancer remains one of the leading causes of death all around the world, and it's estimated that by 2030, the number of cancer deaths will almost double. So early diagnosis is crucial to reducing cancer-related deaths. That is, the earlier the disease is diagnosed, the higher the chances of treatment success. But sadly, many aren't caught until the later stages, and this is largely due to a lack of fast and effective diagnostic tools, and that's where research is vital. So that prompted our team to test the latest research on a relatively small group of people, and the findings have been quite encouraging. It could potentially bring us closer to a quick, simple way to detect cancer in its early stages.
Can you give us more details and perhaps explain the importance of the test?
Sure. The test is called CancerSEEK, and it's a unique, non-invasive test that simultaneously evaluates levels of 8 cancer proteins and the presence of cancer gene mutations from circulating DNA in the blood. It's aimed at screening for 8 common cancer types that account for more than 60% of cancer deaths. In fact, 5 of the cancers covered by the test currently have no screening test at all, so that alone gives an indication of its significance to the medical world. The use of a combination of selected biomarkers for early detection also has the potential to change the way we screen for cancer, and it's based on the same rationale for using combinations of drugs to treat cancers. Circulating tumour DNA mutations can be highly specific markers for cancer. So, to capitalise on this, we sought to develop a small yet robust panel that could detect at least one mutation in the vast majority of cancers.
What kind of success rates has it shown in detecting cancer?
It's been a very positive study. From 812 healthy controls, it produced only 7 false positive results, so that was very encouraging. The test itself was evaluated on 1,005 patients with non-metastatic stages 1 to 3 cancers of the ovary, liver, stomach, pancreas, esophagus, colorectum, lung and breast. The median overall sensitivity, or the ability to find cancer, was 70% and ranged from a high of 98% for ovarian cancer to a low of 33% for breast cancer. Still a reasonable result and above what we anticipated. For the 5 cancers that have no screening tests at present, which are ovarian, liver, stomach, pancreatic and esophageal cancers, sensitivity ranged from 69% to 98%.
That's very impressive. Your team must be very pleased. Is there any downside to the test?
Many of the most promising cancer treatments we have today only benefit a small minority of cancer patients, and we consider them major breakthroughs. If we are going to make progress in early cancer detection, we have to begin looking at it in a more realistic way, recognising that no test will detect all cancers. We may only be in the beginning stages, and although CancerSEEK doesn't pick up every cancer, it identifies many more that would likely otherwise go undetected.
What impact are you expecting this to make right away on the general public?
This test represents the next step in changing the focus of cancer research from late-stage disease to early disease, which I believe will be critical to reducing cancer deaths in the long term. As I mentioned, CancerSEEK is non-invasive, so can, in principle, be administered by primary care providers at the time of other routine blood work. This has the potential to substantially impact patients' current levels of access. Earlier detection provides many ways to improve outcomes for patients. Down the road, optimally, cancers would be detected early enough that they could be cured by surgery alone. But even cancers that are not curable by surgery alone will respond better to systemic therapies when there is less advanced disease.
And what about affordability for those undertaking the test?
We feel that a test that will be used routinely for cancer screening must have a cost in line with or less than other currently available screening tests for single cancers, such as a colonoscopy. For example, the average out-of-pocket expense for that procedure is anywhere between $1,000 and $3,000. We envision that the CancerSEEK test will eventually cost less than $500. Of course, much larger studies of the test are currently underway, and cost can't be a determining factor over quality, but I'm very confident that we will be able to keep it at the estimated level.